Okay, this session I'm going to talk regarding the standard precautions. Standard precautions. It refers to those work practice that are applied for everyone, regardless of their perceived or confirmed infectious status, and ensure a minimum level of infection prevention and control is maintained in the healthcare environment. Standard precautions consist of hand hygiene, personal protective equipment, respiratory hygiene and cough etiquette, environmental cleaning, aseptic non-touch techniques, the safe use and disposal of sharps, safe handling of equipment, safe handling of linen, and waste management. We're going to talk through these all topics briefly. Hand hygiene. It is the most effective single measure to prevent transmission of healthcare-associated pathogens, and it must be performed before and after every episode of patient contact, which includes before touching a patient, before a procedure, after a procedure or body substance exposure risks, after touching a patient, after touching a patient's surroundings. Hand hygiene must also be performed after the removal of gloves. There are various factors which affect the hand hygiene practices. For example, unavailable resources, provision of alcohol-based hand rubs and clean water, soap and disposable towels, staff education, monitoring of hand hygiene practices, and performance feedback, reminders in the workplace, and promotion of a patient safety climate. Alcohol-based hand hygiene are generally more effective and faster acting than soap and water, especially when hands are not visibly soiled. PPE, personal protective equipment, refers to a variety of barriers which can be used alone or in combination to protect mucous membranes, airways, skin, and clothing from contact with infectious agent. For example, when there is a risk of contact with blood or body fluids, usually gloves has to be worn. Next, gown and aprons, where there is a risk of splash or contamination. Masks and eye protections are important when there is a risk of droplets or splashes. And always remember, it is very important that to remove and dispose PPE materials safely after use. The proper PPE sequence should be followed while donning the PPE. The hand hygiene is very important, followed by donning the gown, then using the mask or respirator, then followed by eye protection, and the last one is the gloves. While doffing PPE, first thing to be removed is the gloves because it's a highly contaminated one, followed by goggles or any eyewear, and next followed by the gown, doffing, and then the last will be the marks. Next, the sharps and the waste management. It is very important that we follow the proper guidance in regards to the sharp and waste management according to the local policies and the organization policy. The first thing is never recap the needles, which can increase the needle stick injury. Dispose immediately into sharp containers after use, and more importantly, segregate clinical and general waste. Next is regarding the environmental cleaning and equipment. It is important that there is a regular cleaning schedule for frequently touched surfaces, especially when there is an outbreak in the facility. There should be a routine cleaning and disinfecting reusable equipment between the patients, for example, hoists, weighing machines, or anything which has potential to transmit the infectious agent. And also use appropriate disinfectant as per the guideline of the organization. Regarding the linen and laundry, It should be handled carefully with minimal hesitation. It should be a bag at the point of the use. Always wash using the hot water and the detergent, and always follow the standard precautions while handling the soil linen. That's in the brief presentation on the standard precautions. If you have any questions, don't hesitate to write in the comment. Thank you.